There are moments in modern history when a crisis reveals far more than the crisis itself, not because of the virus or the war or the disaster at the center of the story, but because of how institutions respond when pressure finally arrives. We may be living through one of those moments right now, because what unfolded aboard a Dutch cruise ship last week was not just a medical emergency, it was a stress test, a test of preparedness, a test of leadership, a test of whether the most powerful country on earth still possesses the institutional competence that once allowed it to confront global emergencies faster and more effectively than anyone else. And the early results are deeply troubling. Let's begin with the facts, because in moments like these, precision matters. The cruise ship in question departed Argentina in early April on what was supposed to be a routine luxury expedition through the South Atlantic. Passengers visited remote islands, watched penguins along the coastlines of South Georgia, crossed icy waters, and documented the entire experience online like every other modern cruise vacation. But somewhere during that journey, something changed. By the time the vessel approached Spain, days later, multiple passengers had become violently ill. 3 people were dead. Several others had tested positive for a hantavirus infection, specifically the Andes strain, one of the few hantaviruses on Earth known to spread from person to person. And suddenly, what began as an isolated medical incident became something much larger. Now, hantaviruses are not new. Scientists have studied them for decades. Most strains spread through exposure to infected rodents and are extremely difficult to transmit between humans, but the Andes strain is different. It possesses characteristics that make epidemiologists deeply uncomfortable because, unlike most of its relatives, this particular strain has demonstrated confirmed human-to-human transmission in previous outbreaks. That distinction changes everything. The mortality rate for hantaviruses varies dramatically depending on the strain and the speed of treatment. Some cases remain mild, others become catastrophic respiratory failures. Estimates for the Andes strain fatality rate have ranged as high as 30%. There is no universally effective antiviral cure, no miracle treatment, no guaranteed vaccine platform sitting on shelves ready for immediate deployment. In most cases, supportive care is the only option while doctors hope the patient's immune system can survive long enough to recover. And yes, that word matters here, hope, because hope appears to be doing an extraordinary amount of heavy lifting in the current American pandemic strategy. When reporters asked President Trump about the outbreak, his response was striking not because it was dramatic, but because it was so visibly improvised. There was no detailed containment explanation, no structured federal response framework, no reassurance grounded in operational competence. Instead, the message was essentially this: we hope it's under control. Hope that would be concerning under any circumstances. But it becomes significantly more concerning when paired with what has quietly happened to America's public health infrastructure over the last several years. Because the reality is that the United States did once possess one of the most sophisticated pandemic response systems ever built. The CDC, the NIH, International Disease Monitoring Networks, partnerships with the World Health Organization, rapid response laboratories, global early warning systems, all of it existed for precisely this kind of scenario. And much of that architecture has now either been weakened, politicized, or dismantled. According to former CDC officials, one of the most immediate problems in this case is information flow. The United States is no longer operating with the same integration into global health coordination systems that it once maintained. Following the formal withdrawal from the World Health Organization earlier this year, communication pipelines that previously delivered rapid outbreak intelligence are no longer functioning the same way. That matters more than most people realize. Pandemic response is fundamentally about time. The earlier a country receives accurate information, the more options it has. Days matter, sometimes hours matter. Early detection determines quarantine speed, travel screening efficiency, hospital readiness, supply chain mobilization, and vaccine research prioritization. Lose the information advantage and everything downstream becomes harder. And that is precisely the concern now emerging among public health experts. Because while international health agencies were already coordinating around the cruise ship outbreak, the American response appeared fragmented and unusually slow. The CDC classified the situation at a relatively low emergency response level despite fatalities already being confirmed. Former officials openly questioned why the response infrastructure appeared hesitant during the early stages of a potentially dangerous outbreak. And the answer, increasingly, appears to be institutional degradation. Over the past several years, critical research programs studying emerging infectious diseases have been cut or deprioritized, funding pipelines narrowed, research centers closed. Senior career scientists departed agencies in unusually high numbers. Pandemic preparedness increasingly became entangled in ideological and political warfare instead of remaining a technocratic national security priority. One of the more astonishing details to emerge from recent reporting is that a research initiative previously studying hantavirus spillover risks had its funding eliminated during broader restructuring efforts. The cost of that research program was reportedly tiny by federal standards, roughly equivalent to what the government spends on administrative overhead in a matter of hours. Yet it disappeared anyway. And this is where the broader story begins to emerge, because the hantavirus outbreak itself may ultimately remain limited. It may be contained. The cruise ship passengers may be quarantined effectively. The disease may fail to establish wider transmission chains. Public health officials may ultimately prevent any large-scale spread. All of that is entirely possible, but the deeper issue is not the size of this outbreak. The deeper issue is what this outbreak revealed about preparedness capacity if something far worse arrives later. That is the real concern, because modern pandemics do not wait for governments to become organized. Viruses exploit hesitation, they exploit confusion, they exploit fragmented communication systems and politicized institutions, and the uncomfortable truth is that the United States currently appears significantly less institutionally cohesive than it was prior to COVID-19. Consider the vaccine dimension alone. One of the reasons the world managed to produce COVID vaccines at historic speed was the development of mRNA technology platforms. Whatever criticisms people may hold about pharmaceutical companies or public messaging during the pandemic, the underlying scientific breakthrough was undeniably extraordinary. The ability to rapidly sequence and produce targeted vaccines compressed timelines from potentially a decade into under a year. That was one of the great scientific achievements of the modern era. And yet much of that infrastructure has since become politically radioactive. Funding battles, conspiracy movements, public distrust campaigns, and ideological attacks on scientific institutions have created an environment where some of the very tools most likely to help during the next pandemic are now treated with suspicion by large portions of the population. Researchers have described increasing pressure, political hostility, and growing uncertainty surrounding long-term investment into next-generation vaccine technologies. That creates a dangerous paradox. The country most capable of leading global biomedical innovation is simultaneously undermining confidence in the very systems that made that innovation possible. And this is not happening in isolation. The broader federal public health system has also experienced substantial turnover. Agencies once dominated by career technocrats increasingly face political loyalty pressures. Senior expertise has been lost. Institutional memory has eroded. Entire departments responsible for emerging disease coordination now operate with fewer experienced personnel than they possessed prior to COVID. The result is something that looks functional from a distance but feels increasingly hollow up close. And that matters enormously because pandemics are not simply medical events. They are organizational events. They test logistics, communication, trust, competence, and state capacity simultaneously. The countries that perform well are rarely the countries with the most dramatic speeches. They are the countries with the most disciplined systems, which brings us back to the cruise ship, because in many ways, the ship itself became a floating metaphor for globalization in the 21st century. A disease emerging thousands of miles away can now traverse continents in days. A handful of infections can instantly become an international coordination challenge involving multiple governments, airlines, hospitals, shipping authorities, and health agencies. And the countries best positioned to handle that reality will be the ones capable of integrating science, policy, and rapid decision-making without collapsing into partisan paralysis. That is where the United States increasingly appears vulnerable. Not because America lacks resources. It still possesses immense resources. Not because American scientists are incapable. They remain among the best in the world, but because the connective tissue between expertise and governance has weakened. And once that connective tissue deteriorates, rebuilding it becomes extremely difficult. Public trust declines, coordination slows, information fragments. Every crisis becomes politicized before it is even understood, and that may be the most dangerous lesson of all. The problem is not simply whether this specific hantavirus outbreak becomes larger. The problem is that every future outbreak now unfolds against the backdrop of a country whose institutions no longer command automatic public confidence. Every federal response becomes immediately contested territory. Every scientific recommendation becomes ideological ammunition. Every emergency briefing becomes partisan theater. Pandemic response cannot function efficiently under those conditions, because viruses do not care about political tribes. They do not care about cable news narratives or election cycles or internet conspiracy theories. They spread according to biology, mobility, and timing. And when societies become incapable of producing shared reality during emergencies, their response capacity deteriorates rapidly regardless of wealth or military power. The uncomfortable truth is that many of the systems dismantled or weakened over recent years were not luxuries, they were redundancies. And redundancies are what keep complex societies functioning during stress. Early warning networks, research partnerships, international coordination mechanisms, specialized laboratories, long-term disease surveillance programs. These systems often appear unnecessary right up until the moment they become indispensable. And by then, rebuilding them is too late. The cruise ship outbreak may ultimately fade into a historical footnote. It may remain a contained event remembered mostly by epidemiologists and the passengers unfortunate enough to experience it firsthand. But historians may also look back at moments like this as warnings that were visible long before larger crises arrived. Warnings about institutional complacency. Warnings about politicizing expertise. Warnings about what happens when societies convince themselves preparedness is optional because catastrophe has not happened recently enough to feel real anymore. The most dangerous thing about pandemics is not simply the pathogen itself. It is the illusion of normalcy that exists right before systems become overwhelmed. The belief that someone else is handling it, that somebody smarter somewhere already has a plan, that things will probably be fine because they usually are. Until suddenly they are not. And that is why this story matters far beyond one cruise ship in the Atlantic. Because what was really exposed here was not just a virus, it was the growing gap between the scale of modern global threats and the weakening institutional structures meant to confront them. The world is becoming more interconnected, more biologically vulnerable, and more politically fragmented at the exact same time. That combination is extraordinarily dangerous. And if the current American pandemic strategy truly boils down to "we hope," then hope may be carrying far more responsibility than it was ever designed to handle.